The following program is brought to you by Naleo TV, the People's Platform. This program is freely available to the public, thanks to the generous funding from Hui Pohala and the Hawaii Department of Human Services, MedQuest Division.
Aloha and welcome. I'm Lani Weigert, your host for Let's Talk Health Care Hawai, a new healthcare series to help our community navigate through the many challenges of acquiring quality healthcare for those living with a serious illness, such as cancer, congestive heart failure, COPD, kidney, lung, and liver disease. So ho'olohe, listen up, especially those caring for a seriously ill relative. You will not want to miss a single episode. If you've never heard the term palliative care, don't worry, you are not alone. The goal of palliative care is to prevent visits to the emergency room, boost the quality of life, and relieve suffering from chronic illness and treatments such as chemotherapy, radiation, dialysis, and surgery. Whether you're new to palliative care or not, this series is designed to raise your awareness on acquiring community resources, making timely and informed healthcare decisions with your physician and palliative care team that will benefit you and your ohana. In this first episode, we will explore what is palliative care and who can benefit from it. Are you or someone you know just been told that you have a serious illness such as cancer, congestive heart failure, COPD, or kidney failure? Have you been receiving treatments for your illness, wishing you had more support with your symptoms at home? In this episode, we welcome Dr. Glenda Dolan, Hilo family physician with over 33 years of experience in hospice and palliative medicine. Dr. Dolan will share what is palliative care and who can benefit from it. It's important for patients to understand their medical condition while learning to manage their symptoms associated with their illness. Dr. Dolan brings such a wealth of knowledge to today's show, and I'm thrilled to have her as my guest. Aloha! Dr. Glenda Dolan is with me today. I'm so excited. So my first question is, can you please tell us what is palliative care?
Thank you, Lani. Palliative care can be a little bit confusing for people, but sort of just remember it as this. It is a medical specialty that provides relief from people's pain and symptoms of the illness that they're suffering from. And it could be also from the treatment that they're receiving. And the goal of palliative care is to make sure people have a best, great quality of life while undergoing treatment or progressing through life with a serious illness.
Wow. Can you tell me what are the signs that palliative care is even needed? So I understand that it's going to really put a nice, cozy blanket around us, but how do we know that we even need that?
So I say palliative care begins at the time of a serious diagnosis, like cancer, or at a time when people have lots of medical problems that are happening and they're just struggling with figuring out how to manage it. How do they manage their medicines? They're going to all these appointments and they're just very confused about who's doing what and how do they manage it.
Okay. So who do you think should receive palliative care? And can you tell us a little bit about it? Like, what should we expect? How much does it cost? How difficult is it to even access this kind of care?
Okay, so I'll start with who. Things I tell people to think about, because when we're in healthcare and we're going through our illnesses, we kind of lose sight of where things are. And I tell people to pause and think, okay, are you or your loved one, have they gone to the emergency room a lot? Have they gotten admitted to the hospital? Or to the hospital and then went to a nursing home or to a care home? All those places that I call as a transition of care can be a person who needs palliative care to help them guide through what's happening with them in their health care. The other types of people are people who have a lot of medications. You know, we doctors, we give lots of medicine sometimes, and it gets confusing. Statistically, anyone who's on more than 5 medications, it gets really confusing. How do you manage it? When do you take it? Do they interact? And the palliative care team can kind of help guide you through that. The other one I say is if you're just going to a ton of appointments, whether it's the cardiologist or the lung specialist called a pulmonologist, your primary care doctor, the oncologist, all of those visits can be really challenging, even physical therapy and things like that. The other key thing that's a little bit more subtle, and this is more for families with people who have elder people in their home or that they help take care of, if they're not able to get out of the house as much, they're not able to make that favorite meal anymore because they forget how the ingredients, or they're not able to give themselves a shower or a bath safely because they're slipping or falling a lot, and or just weaker, not able to get up off the couch, those sorts of things.
Wow. Can you think of a patient, maybe just give me a story of somebody that came to you, you decided that palliative care would help them, and then what difference did it make to them and their caregiver?
So a scenario that's near and dear to my heart is someone who has something called end-stage kidney disease, and they're on dialysis, and also they have something called congestive heart failure. Those two together are really challenging diagnoses. And the experience I had with this patient was that they were doing dialysis, they were having trouble breathing, they were on lots of medications, they were seeing the nephrologist, the cardiologist, me, going back and forth to the ER. All their medications were getting adjusted by all of us, but we all weren't necessarily talking and getting each other's notes and things like that. And that was challenging. And bringing palliative care into that realm with that family and that patient really helped keep us as specialists and primary care docs all glued together, as well as help that family and the patient, move through all these different healthcare points of care, I call it.
That's a perfect segue into us taking a look at what does the care and all of the things that really are part of palliative care. And let's take a look at the graphic that you created for us. And can you kind of explain to us what it all means?
So who and how is really how I'll talk about it. Is the center is the patient, as I kind of alluded to earlier. And what happens with the palliative care team is the patient and family, honestly, are at the center trying to then those of us around are bringing all the care to them and the understanding. So going from the top and going clockwise, we manage symptoms. So we help manage pain, nausea, vomiting, shortness of breath, and even symptoms of emotional. We call that existential suffering, things like that add into and are actually probably the most important thing to manage when people are going through all of these symptoms and illnesses. We help coordinate care of the patient. So patients have their family, they may have hired caregivers, they may live in a care home, and they may have other people from their insurance plan that can kind of help coordinate things as well. But who has time to do all that phone calls and stuff? So the palliative care team, including which we would call a social worker, can help do that. Educate the patient, just like I talked about with the patient with the dialysis and the congestive heart failure, educating them on when to take the medicine that would be more advantageous for them to feel better. And then we always have to work with the insurance companies and their coverage of things, as well as they do have resources as well to help patients and sometimes even pay for in our community. Most important, families and caregivers, because even though the patient's receiving the care, the stress and strain on family and caregivers, you have to take time off. These appointments don't match up, all of those sorts of things. And then community resources. There's lots of things out there that even I, as a PCP, I can't keep track of it all. And so the palliative care team, which we call in our organization Kupu Care, is a nurse practitioner, a registered nurse, a licensed clinical social worker, volunteers, and other people who will help coordinate that. Then, at the same time, we work together with the primary care doctor and any of the specialists that the patients have, whether we ring them up, whether we send them progress notes, whether we figure out meeting together. The Kupu team people go to the appointments with the patient and family to figure out how best to manage all of this. And so I consider it almost like we're the communicators amongst all of the team for that patient.
Gosh, that was so much information. Now I have even more questions. With all of that help, why is it that patients don't come and seek that kind of support? That's so much support that a lot of, especially those who are taking care of their elderly relatives, they're working full time and they have no idea that this even exists. Tell me why people are not stepping up and just grabbing at this.
Well, I think there's a couple reasons. One, it's a relatively young specialty in the healthcare field of medicine. Two, it's a different concept of working as a team, and lots of people are used to just going to the doctor and then they leave, but realizing there's more to it than just the primary care doctor or the specialist. The other thing is some people worry that, well, what is it? Do I have to pay for it? That sort of thing. In terms of costs, it is a benefit to all patients because it's no different than when you go to the cardiologist, your primary care doctor, the pulmonologist. You go, you see them, and you pay a copayment. There's nothing more than that. The other part of it is that using a team who have their own specialty within the team gives that full wraparound, you called it a blanket, of services. And so it's not like we're all in these individual silos. We're bringing those silos together almost for a bigger circle in order to help that patient.
That is great. So tell me, if the people that are listening out there, if they do not have this care yet, what kind of response will they have if they just go into their primary care provider and say, I would like palliative care? What should they expect?
Well, I hope they're going to say, the primary care doc is going to say yes. Sometimes we're working on educating our community more and more about this service as well and letting people know how we manage it with them. And I really want to make it clear that we do not take over the care from the primary care doctor or the specialist. We work all together. And the other option is patients can call Hawaii Care Choices directly, and then we will help coordinate with your physicians who are taking care of your loved one or the patient themselves in order to get this ball rolling. There's really no barriers in terms of insurance or anything like that. I think the barrier is the unknown. And I always say, try it. You might like it, and it might be really beneficial. The other thing is I mentioned all the things that we provide. Sometimes people don't need all of it. They only need one piece of the wheel or something like that, or they prefer to only have one portion of it. I always say, hey, take the whole kit and caboodle. But if people don't want the volunteer or aren't interested in the social worker, that's okay. But there's lots of things that different team members can do. The APRN helps with the symptom management and the medications. The nurse helps with the medications and education on the disease and how much salt should you eat or not, those sorts of things. The social worker can help guide through the different resources in the community, as well as even work on what we call an advanced healthcare directive or a PULSE, which is a physician's order of life-sustaining therapies, because we want to know what the patient wants.
Yes.
Because it's not all about medicines. It's about what they want in their life, what they value, what their goals are for them, and educating the treating team what that patient wants. Because sometimes we forget to pause and say, what would you like?
Wow. I'm so glad you brought up about goals and values so that people can really live on their own terms. How does that look? Can you explain to me, like, what could a patient who signs up for this kind of care, what does that mean to them?
So first, I'd like to say people ask, like, how long is this? Is it a one-time visit? Is it a longitudinal visit? And yes, it's longitudinal. How long you receive the services, it all depends on the patient's needs, their illness, and their other needs. I call that the needs of life and their quality in that. What it looks like from, I think, the patient perspective is maybe it's a little overwhelming initially because there's these people coming in because they come to your house. They can go to your care home. They can go meet you at a doctor's office, those sorts of things. And educating them on the different steps or what we identify as their needs and what they would like us to help them with.
So who do you think this would affect the most? Is it the patient, the caregiver, or both?
Both.
Okay.
All the
All right.
above. And I would say it actually helps the treating physicians, the primary care doctor, the specialist as well. Because there are things as a physician that I just can't get to in my office that the patient or family calls, hey, we have this issue right now. The wonderful thing is then they could call the nurse on the kupu team. The nurse can assess the situation and give me a better understanding and story and picture, even though I'm not there, to figure out what the next steps are. So they're kind of like the eyes and ears in the patient's home with the family that then helps the other treating physicians make better healthcare decisions, medication management for them.
Oh, that's great. So you mentioned kupu care. So kupu care is palliative care.
Correct.
Awesome. Okay. So I'm just thinking about listeners who are tuning in and they're thinking about, I'm trying to get some help and support from my mom. She's at home most of the day by herself. She has COPD and CHF. Would you recommend that they go in and try to get this kind of support and help for mom?
Absolutely. Because we go in, we assess, we look at things, and we see what is needed, maybe what is needed more importantly. And sometimes it's not the medication. Sometimes it's, I need help finding support and caregivers that are vetted and will come to the home and help my mom when I'm not here. Again, it could be that they're visiting you and seeing you every couple of weeks, once a month, a few times a year, maybe not necessarily yearly, but in between, depending on people's illness and disease.
So they could actually be with kupu care, palliative care for as long as it takes.
Correct.
So it's not 3 months
Correct.
or something,
I
for as long as they need.
Yeah, and I use the example of what you just said, someone who's more senior. They have a little bit different needs in terms of help in the home versus that young mom who was diagnosed with breast cancer and is like, oh, now what do I do? How do I manage this? And bringing them into the fold and getting the help that they need to manage their symptoms, manage like, how do I balance this? How do I work? I got to get the kids to school, all of that sort of stuff.
Wow. So, Doctor, you gave us just a boatload of information. Thank you so much for being with us today. And we are going to summarize a lot of what you just gave us and do it in the takeaways at the end of the show. Thank you so much, Doctor, for coming in today.
Thank you, Lani.
Aloha. Next, we have a special testimonial from one of our community members who is already on the palliative care journey, Glenda Tahara, who lives in Hilo, shares her experience with Kupu Care, our palliative care program.
Palliative is an amazing program, and if you're out there and you need help, I suggest you guys call Kupu Care because it helps, and I'm grateful for it. It's like amazing for me because from where I was before a year ago, like I was down in the dumps, everything, and I didn't want to live. I had so much health issues going on. I still do, but then they help me, feel better, and they give me tools to use, suggestions and stuff. So yeah, I'm very thankful for this program. They listen to me when I have like issues going on, and I need that because I'm a homebody. I don't like to go out. I don't deal with a lot of people. It's too much drama, it's too much stress, too much anxiety. So when they come here, it's like I feel comfortable with them.
Mahalo, Glenda, for sharing that beautiful experience. Your story will be so helpful to those who may be in a similar situation as you. We wish you the very best on your palliative care journey. We also have here April Ciao, who is Glenda's palliative care nurse. We would love to hear from April on what it means to be Glenda's healthcare advocate and how April's support and guidance is affecting Glenda's quality of life. Let's hear what April has to share with us.
So for me, being a palliative care nurse means being a teacher and being a partner with my patients. I really enjoy the relationships that we form. In addition to coming out and talking about how people's physical health is doing, we come out and we chat about, what's going on in their lives. We were just talking about, upcoming class reunion and how the planning for that is going. And I get to meet people's pets and people's children and grandchildren. And, for me, that's the most rewarding part of the job is developing those relationships. Yeah. And I think that's what makes it work when we're talking about physical health. When I have a suggestion, or when we're talking about changes to make, or things that are going on, we have that relationship established. And so, people know that I'm in their corner, I'm on their side, and they can trust the recommendations that I'm giving. When I first met Glenda, it takes a little while to build a relationship with somebody. You spend some time feeling each other out and getting to know the other person. And over time, I think we've developed a relationship of trust. And, I really enjoy hearing about her life and the other things that are going on. She's planning her class reunion right now, and I've heard about the ups and downs with that. I've heard stories of her grandson, and I really appreciate that kind of thing. That's what makes the job, a meaningful job to me, is having the chance to really connect on that level with people.
Mahalo, April. We are so grateful for the love and compassionate care you provide for our East Hawaii Ohana. You and all of our frontline healthcare team are truly, truly appreciated. Mahalo. There was so much information shared by our guests today. Let's take a moment to summarize with a few takeaways. Number 1, palliative care helps one understand their medical condition, medications, and how to get support within the healthcare system. Why that is so important is so many people will come home after a diagnosis and have no idea about the information with their illness. They will not know what is next for them. The role of the physician is to look for a cure or treatments that can slow down the disease progression. The palliative care or kupu care team focuses on the values, wishes, and hopes of the patient to ensure that they can live on their own terms at home. It's so important to have both parts working together, the physician and the kupu care team, so the outcome for the patient and family will be successful. Number 2, the palliative care team, also called kupu care team, teaches one at home on how to manage their symptoms such as pain, nausea, anxiety, insomnia, to avoid going to the emergency room. We immediately go to the emergency room, but not all of us can afford to do that. It's so wonderful if we could just know a few things at home that will avoid that one more trip in the ambulance to the emergency room. The kupu care team are your teachers. They are a resource that comes to your home and will help both the patient and the caregiver. Our goal is to only reduce the discomfort of the symptoms, but also we want to reduce the anxiety and frustration of the caregiver and family. We want to be there to support everyone in the family as well as the patient. Number 3, palliative care team, also called kupu care team, helps one live life on their own terms. This is so important. We meet people every day that are depressed from the chronic pain that they've been living with for years at some point, who had no idea that they could get relief. We want you to know relief is on the way. You simply need to call us. We are hoping this information that we shared today will empower you to connect with us. Do not wait. Your healthcare is your kuleana, your responsibility. Take action now and call us today. Let me tell you more about our palliative care program. Who qualifies? Those with cancer, congestive heart failure, advanced renal kidney disease, advanced liver disease, chronic lung disease, also known as COPD. How are these services paid for? Palliative care, also known as kupu care, is covered under most insurance plans. You may be responsible for a copayment based on the type of insurance you have, similar to an amount you would pay when visiting a specialist. How does one know they need palliative care? Well, if you or a loved one is experiencing symptoms such as frequent pain, nausea, anxiety, shortness of breath, or depression, palliative care may be for you. Is your caregiver overwhelmed, tired, and frustrated? Are you visiting the emergency room several times in 60 days? Do you need to call your physician often? If you've answered yes to any of these, then it's time to consider palliative care. Getting the support early is key. Patients can receive palliative care at any age, ideally at the time of diagnosis. Early support can reduce anxiety and stress for both the patient and caregiver. Besides providing support, palliative care also provides solutions, such as education on managing your pain, discomfort, and nutrition. Also, a plan of care is created based on your priorities and values. Help with coordination for doctor visits and medications. Referrals to helpful services in the community. And also to ensure you have an advanced care directive. How is palliative care different from routine care? Palliative care is specialized care. While the physician focuses on the cure, our kupu care team focuses on the physical and emotional care of the patient and family, ensuring the patient's values, wishes, and life goals are at the center of their care. This holistic approach is why palliative care uniquely works. Plus, the care is provided in the comfort and convenience of a patient's home to help reduce stress, pain, and suffering associated with the illness, while also boosting the quality of life for both the patient and family. We hope this episode has raised your awareness about palliative care for those living with a serious illness. It's such an honor and privilege to spend this time together. Mahalo for joining us. This segment will air every Thursday and Sunday at 7 p.m. on the Leo TV Channel 54 throughout this month, with a new episode airing next month. You can also view this on our Hawaiʻi Care Choices YouTube channel. Mahalo to our ohana and friends listening over your favorite podcast channel. A new podcast episode will also be posted at the beginning of each month. For more information on this episode or to send a question for the next show, please go to our website at www.hawaiicarechoices.org or call us Monday through Friday during normal business hours at 808-969-1733 to leave your question. I'm your host, Lani Weigert, sending you all much love and compassion. Until we meet again, let's talk healthcare Hawaii. Aloha, ahuiho.
Mahalo to MedQuest, Hawaiʻi Care Choices, Brenda S. Ho, CEO, and guest speaker Dr. Dolan.